Hey everyone, and welcome to this explainer. Today we're diving into a deeply emotional and, honestly, a highly clinical journey, twin-to-twin transfusion syndrome, or TTTS. For expecting parents, this diagnosis completely turns the absolute joy of having multiples into a sudden, high-stakes medical emergency. We're going to navigate this entire experience today right through the eyes of the parents and the hard data of medical professionals, moving all the way from that shocking initial diagnosis straight through to the realities of the NICU. Now, this quote right here from a parent forum, it just perfectly captures the absolute whirlwind of a sudden high-risk diagnosis. Think about it. One minute you are happily picking out names for two babies, and literally in the span of a 72-hour window, you might find yourself rushed to a specialist hospital, being told your baby's lives are in immediate danger, and you're suddenly being prepped for fetal surgery. The sheer velocity of this trauma is something parents just have to process while physically carrying the pregnancy. It's a lot. So we really have to ask ourselves, what exactly happens when a twin pregnancy becomes a literal fight for survival? How do parents and doctors tackle this terrifying medical anomaly together? Throughout this explainer, we'll look at how they manage to balance desperately holding on to hope with the cold, hard clinical realities they absolutely must face to save these tiny lives. Okay, here's a quick look at our roadmap. We're following the chronological path: the shock of TTTS, preparing for laser surgery, the post-op waiting game, navigating premature birth, the NICU roller coaster, and finally, support, hope, and healing. Section 1. The shock of TTTS. Picture this. You're at a routine 16-week ultrasound, and suddenly the room gets really quiet. That's when parents are often thrown into the harsh reality of TTTS. Basically, in identical twins who share a single placenta, abnormal connecting blood vessels create a severe vascular imbalance. It acts kind of like a one-way valve, where blood flows unevenly from one baby to the other. And as you can imagine, this creates a life-threatening dynamic for both of them. The dual impact here is immediate and it's terrifying. On one hand, you have the donor twin, who is giving away their blood supply and becoming severely dehydrated. On an ultrasound, their bladder actually vanishes, and they appear literally shrink-wrapped against the uterine wall because they just don't have enough amniotic fluid. But then on the flip side, the recipient twin is getting overloaded with all that extra blood and fluid. This leads to severe heart strain and a dangerously enlarged amniotic sac. So both babies are in critical danger, but for entirely opposite reasons. Section 2. Preparing for laser surgery. So to treat this, doctors use fetoscopic laser surgery. Let's demystify what sounds like a totally intimidating sci-fi procedure. Through a tiny incision, surgeons insert a camera and a laser directly into the womb. They use the camera to map out the placenta's blood vessels, almost like they're reading a road map. Then, they use the laser on those connecting vessels to stop the shared flow. Mothers actually often describe feeling a distinct popping sensation when this happens. Finally, they drain that dangerous excess amniotic fluid from the recipient twin's sac. But we cannot gloss over the physical toll this takes on the mother. Managing recovery after fetal surgery is grueling. You're fasting, but you desperately need hydration for what are often very painful IV insertions. You're dealing with catheters and hospital gowns, so honestly, a massive pro tip here: pack your hospital bag early and bring your own comfortable pajamas. You also have to brace for the harsh side effects of magnesium sulfate, which is used to stop contractions. It can cause intense burning sensations, chest pain, and severe nausea. It's a real test of endurance. Now, considering how incredibly daunting the hospital stay and the surgery are, we have to look at why doctors push for it so urgently. This data from Leiden University, which is a major national referral center for this specific laser treatment, gives parents a desperately needed clinical anchor of hope when they are right in the middle of all that chaos. And here is why they do it. Through some absolutely incredible advancements in this fetoscopic laser surgery technique over the years, the overall survival rate for these twins has jumped from 70% up to an amazing 80%. That single number right there, that is the light at the end of the tunnel for terrified parents sitting in pre-op. But it gets even better. The long-term data is incredibly reassuring. Recent cohorts of TTTS survivors show that severe neurodevelopmental impairments, we're talking things like cerebral palsy or severe cognitive delays, have dropped dramatically from 18% down to just 6%. So the surgery isn't just saving lives, it is dramatically improving the quality of those lives. Section 3. The post-op waiting game. After surgery, parents enter this phase where they are basically living appointment to appointment. The immediate postoperative recovery period, specifically the first 14 days, is a terrifying watch for fluid leaks or any signs of miscarriage. Then you settle into weekly ultrasounds to obsessively track fetal growth metrics. They are constantly checking brain blood flow and watching to see if the donor twins' bladder refills. The ultimate desperate goal of all this monitoring is to just make it past 30 weeks gestation so they can have a safer delivery. During this time, mothers are almost always put on strict, modified bed rest. And, this often triggers intense guilt, especially if they have other kids at home they can't pick up or run around with. But listen, self-care here is completely non-negotiable. Bed rest is not doing nothing. You are actively recovering from major fetal surgery, and you are actively working to keep two tiny human beings alive.
Section 4. Navigating premature birth.
Let's talk about preparing for premature birth, because the crucial point here is practical and mental preparation. Because sudden bleeding or fluid leaks can trigger an emergency C-section at a moment's notice, you've got to be ready. Mentally prepare yourself for a very crowded operating room. One couple even reported having 26 medical staff present. Know going in that your babies will likely be whisked away immediately by neonatologists. And most importantly, try not to panic if a baby turns blue or needs resuscitation. The specialists are in that room for exactly that reason. Section 5. The NICU roller coaster. Walking into the NICU for the first time is a massive, heavy hit. You're trying to manage the exhausting logistical challenges of hospital commutes, and then you see your fragile, premature newborns hooked up to CPAP machines. Your natural instinct to just pick them up and hold them is totally overwhelmed by their medical fragility. As this incredibly raw account from a mother's blog highlights, it is a profoundly overwhelming environment to step into. To survive the NICU roller coaster, parents really have to adapt to some harsh clinical realities. For instance, premature babies won't even develop a suck reflex to feed until about 34 weeks, so knowing that helps normalize the tube feeding. You also have to brace for sudden, scary health updates like unexpected brain damage or microcephaly resulting from the earlier TTTS trauma. Because the stress is so high, honest, completely open communication with your partner is vital. You've got to lean on each other. And you have to celebrate the tiny milestones, like finally moving to a low-dependency ward, as you slowly prepare for that massive transition of taking your NICU graduates home. Section 6. Support, Hope, and Healing. A TTS diagnosis is incredibly isolating because, let's be honest, most people have never even heard of it. That's why finding dedicated online parent networks, like the TTS Hope and Connections Facebook group, or leaning on expert resources like the Twins Trust, is absolutely critical for your sanity. Veterans of this journey strongly advise taking practical steps to find trauma-informed mental health support early on, just to help process the PTSD of the surgery and the NICU stay. But above all else, veteran parents echo one major sentiment: never lose hope, even during the darkest setbacks. We so often view twin pregnancies purely as double the fun blessings, right? But knowing the immense hidden trauma that these families are battling behind closed hospital doors, how can we as a society better support parents who are navigating this silent, high-risk fight for survival? It's something to really think about. Thanks for joining me for this explainer. Keep learning, stay empathetic, and I'll see you next time.